Heart disease is the #1 killer of women, more than all forms of cancer combined. But why are so many women still diagnosed late or even dismissed when they seek help? The answer lies in a dangerous truth. The symptoms of a heart attack in women are often completely different from what we see in the movies. We often think of crushing chest pain, but for many women, the signs are much more subtle. They can feel indigestion anxiety or simply a feeling of being unwell. This confusion can lead to tragic consequences. Today's video is a warning and, more importantly, a survival guide. We will point out the top 5 heart attack signs in women that are most often ignored. Recognizing these silent signs can be the difference between life and death. For yourself or for a mother, a sister, or a friend you love. Let's find out. The first sign, and one of the most frequently ignored, is unusual and extreme fatigue. This isn't the feeling of sleepiness at the end of a long day or after a restless night. This is a profound exhaustion, a bone-deep fatigue that you've never experienced before. Many women describe it as feeling like you've just run a marathon, even though you were just sitting still in a chair. Simple daily tasks like making the bed, walking to the mailbox, or even taking a shower can feel like an insurmountable burden. Why is this important sign so often ignored? Because the lives of modern women are already very busy. They have to balance work, family, and countless other responsibilities. When this feeling of fatigue hits, their first thought is often, "It's probably because I'm stressed. It's because I didn't get enough sleep," or "I must be overworking myself." They tend to try to endure it and carry on, not realizing that this could be the cry for help from a heart that is struggling to pump blood throughout the body. So, how do you tell the difference? Pay attention if this fatigue appears suddenly and for no clear reason. It can last for days or even weeks before an actual heart attack occurs. And most importantly, it doesn't get significantly better even if you try to rest or sleep more. If you sleep a full 8 hours but still wake up feeling exhausted, that is a huge red flag that needs attention. The second silent sign is also very common and extremely dangerous if ignored. It is the feeling of shortness of breath. This isn't the feeling of being out of breath after climbing 5 flights of stairs. This is shortness of breath that appears abnormally. You could be sitting watching TV, talking on the phone, or just walking inside your house, and suddenly, you feel like you can't take a deep breath, as if a heavy weight is pressing on your chest. In some cases, this feeling of shortness of breath can even be so bad that it wakes you up in the middle of the night. The main reason this symptom is taken lightly is because it often appears without the classic chest pain. Many women think they are just having an anxiety attack. It's due to asthma, or simply that, "I haven't been active lately, so my fitness is weaker." They don't connect this feeling of shortness of breath with a heart problem. So what is the warning sign? It's a sudden change from your normal state. If yesterday you could carry your shopping basket easily, but today just walking from the living room to the kitchen makes you gasp for air, that is a red flag. Ask yourself, is this feeling new? Is it unusual? If the answer is yes, you need to take it seriously. This is one of the most important heart attack signs your heart is trying to tell you. The third sign is one of the main reasons heart attacks in women are misdiagnosed. It is pain that appears in unexpected places. Forget the image of a hand clutching the left chest. For women, heart-related pain may not appear in the chest at all. Instead, it might be a feeling of pressure or a dull ache in the upper back, especially the area between the shoulder blades. The pain can also radiate up to the neck or jaw, sometimes mistaken for a toothache or TMJ problems. Other women feel pain or discomfort in the upper abdomen, similar to severe indigestion or as if something is pressing down on them. And, of course, it can also be a feeling of pain or numbness in one or both arms, heart attack. Arm pain. Why are these pains dangerous? Because they are very easily blamed on other causes. A backache, probably from sitting incorrectly. Jaw pain, probably from grinding my teeth at night. Stomach pain, probably because I ate something bad. We have thousands of reasons to rationalize these pains without ever thinking that it could be our heart in danger. So, how do you recognize it? Heart-related pain often feels strange and deeper than typical muscle pain. It might not be intensely sharp, but just a dull ache, yet it comes and goes abnormally or persists without relief even when you change positions or rest. If you have pain in these locations that just feels not right, trust that feeling. The fourth sign is a trio of symptoms that often go together and are very easy to misinterpret. They are cold sweats, nausea, and dizziness. Imagine you are sitting still in a cool room, but suddenly your body breaks out in a cold, clammy sweat, as if you've just experienced a major shock. This is accompanied by a churning nausea in your stomach, which might even lead to vomiting. You might also feel dizzy, lightheaded, and unsteady on your feet, as if you are about to faint. This is one of the master of disguise trios of symptoms. Why? Because they are identical to many other health conditions. I probably have the flu. It's probably food poisoning. Or for middle-aged women, they often blame it on the symptoms of perimenopause or menopause. Because there is no clear chest pain. Very few people think this could be a serious heart-related problem. So what's the difference? It's the suddenness and the lack of a logical reason. A flu usually develops slowly with other symptoms like a fever or sore throat. But if you are completely healthy and suddenly feel dizzy, nauseous, and break out in a cold sweat at the same time, especially if it's accompanied by fatigue or shortness of breath, that is a red alert signal. Your body is trying to tell you that your heart isn't getting enough blood. And the final sign, sign number 5, is perhaps the hardest to describe but is critically important. It's not a physical sensation but a psychological one, a feeling of impending doom or extreme anxiety. Many women who have survived a heart attack recall that right before other symptoms became clear, they had a vague but very strong feeling that something terrible was about to happen. It's not the normal anxiety about work or family. It's a primal fear, a sense of impending doom without any logical reason. The danger of this symptom is that it is almost always mistaken for a panic attack. And it's true that the symptoms can be very similar. However, a panic attack is often triggered by a psychological stressor, whereas this feeling of impending doom often appears out of the blue. How do you tell the difference? Trust your intuition. Women often have a very keen intuition about their bodies. If this feeling of extreme anxiety is accompanied by any of the physical symptoms we've mentioned above, even just mild fatigue or indigestion, then the level of danger has increased significantly. Never ignore a strong feeling that your body is in danger. It could be the most sophisticated early warning system you have. Before we finish, I want to speak directly to the women watching this video. Perhaps throughout this video, you've nodded along, recognizing a few familiar symptoms. Perhaps you've experienced that crushing fatigue or that dull backache and you told yourself it's nothing. I'm here to tell you it is not nothing. The medical system for many years was built on research done primarily on men. The classic heart attack symptom is the male symptom. But your body is different and your signals are different. Your health is yours. The right to be heard is yours. Never let anyone, whether it's a family member or even a busy healthcare professional, dismiss your concerns just because they don't look like what's in the textbook. So after watching this video, do one thing. Talk to an important woman in your life, your mother, your sister, your daughter, or a close friend. Ask them about these signs. Turn this knowledge into a conversation. Sharing this video isn't just a click. You are giving them a tool, a form of permission to believe in their own bodies. It might be the most important thing you do today. Thank you for taking the time to listen to such an important topic. Please subscribe to join us on our continued journey to protect our own health and the health of those we love.